It's an illness making national headlines. Enterovirus, an infection that is causing great concern, especially with parents. KCOY 12's Dave Alley spoke with Dr. Mark Juretic of Marian Regional Medical Center to find out what it is and what makes it so dangerous.
Over the past several weeks, Americans have become familiar with a scary virus that was actually first discovered more than 50 years ago.
Enterovirus is a family of viruses that's actually very common, causes a lot of illness, particularly in children, but it's usually very benign illness.
However, this year the virus has been anything but benign. According to the Centers for Disease Control, there's been nearly 1,000 confirmed cases nationally, some of those resulting in death.
In all likelihood, what's happened is the virus has probably mutated, and this is what viruses do. Sometimes the mutation makes them more severe, sometimes it makes them less severe, but this one appears to have made it much more severe.
While kids are more susceptible, particularly those with pre-existing medical conditions such as asthma, everyone is at risk.
People get enterovirus just like they would get other cold or flu viruses. It's by droplets. So if you're in the room with somebody that's coughing and has it, you're likely going to be exposed to it.
Symptoms include what you might typically see in an upper respiratory illness: coughing, wheezing, sneezing, and runny nose.
Unfortunately, there's no easy way to test for it or predict it. But basically, you want to watch your kid. You know your children, you know what they're like. If they seem sicker to you than normal, that's the time to get them checked out.
To help protect yourself from enterovirus, CDC recommends washing hands with soap and water for at least 20 seconds. Avoid touching eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Cover coughs and sneezes with a tissue or shirt sleeve. Clean and disinfect frequently touched surfaces. And to stay home when you're sick. And one more suggestion, this from Dr. Juretic, is to get a flu shot.
It won't really help per se against enterovirus. There's no vaccine, there's no cure or treatment for enterovirus, although most times the body will heal it in time. But since we are entering flu season, getting a flu shot can be helpful in preventing worse illness.
There's some possible good news. Some medical officials are predicting enterovirus, which peaks in the summer and fall, is likely to fade in the winter. Dave Alley, KCOY 12, Central Coast News.